Hello everyone, good morning. This is Dr. Kedar. I am a consultant pediatrician, allergist and infectious diseases specialist with Ankura Hospital in Hyderabad. So the topic of discussion for today is adult vaccinations. Now, why are we discussing about these adult vaccinations at this point of time? What I felt is adult vaccinations are the most crucial things that we should understand. As we know, when the term vaccination comes to our mind, it is always the children. Children receive vaccines as a fixed schedule. So when they receive as a fixed schedule, why not adults is my question here. And why today I'm emphasizing about vaccinations for adults is the topic of discussion for today. When we go to the developed world, like in United States of America, Europe, Australia, etc., adult vaccinations are gaining momentum and they are being given as a scheduled course. Now, what is it that is in store for this country now? Today, I am going to put forward some points based upon my experience and certain studies that I have seen. So, adult vaccinations are essential because of various reasons for which I am going to summarize each and everything in front of you. So, what happens once we are infected? Once we are infected, it causes a social, psychological, emotional, physical burden on us. And the most important thing would be the financial burden, because what diseases I'm going to discuss with you in this particular session, the complications of which have a lifelong consequences. And this leads to a lot of medical problems, not only during the illness, but also after the illness in the form of recovery and rehabilitation. Now, giving an adult vaccination forms a critical part of preventive healthcare structure in our community. Now, I would like to put forth 9 important reasons why we should consider giving adult vaccinations. So, should we receive adult vaccinations in the first place? And mind you, whatever guidelines or whatever things I have read is from the Indian scenario. Vaccine guidelines do change from country to country based upon the prevalence and incidence of infections in that region or community. The first reason why we should receive adult vaccinations. Now, when do you last remember getting a vaccination done? For me, if I remember, the last childhood vaccination that I have taken was DPT when I was, I think, around 8 to 10 years old. I don't remember anything. There is no physical record of any vaccination that I have taken till now. So, what happens? Vaccination is not a lifelong protection. The immunity remembers that particular vaccination or that particular disease and tries to fight it back. But it has a life. Vaccine has a life inside our body also. Maximum, the vaccination that I have taken was DPT. It works for 10 years. But what happens after 10 years? The immune system fades away. So, the first and important reason why we should take vaccination is to boost our immune system, which has already lost its memory for the vaccinations that we have already taken it. The second reason is to protection against new risks. What are the new risks? So, as you know, the diseases are evolving, there is emergence of superbugs, and finally, new diseases variants are coming up in and around the market. In this particular scenario, for to fight against the newer infections and the newer diseases, we need to take the newer vaccinations. Nowadays, a lot of vaccines are available in the market which are taken routinely by the children. So, once the vaccines are given in a mass vaccination drives across the country for children, the viruses and bacteria are looking for hosts. So, who will be the host? We are the hosts because we are not protected by those diseases, from those diseases. So, we become the easy targets of those bacteria and viruses, and hence we can definitely become the targets. And there are certain vaccinations which are age specific, like, for example, pneumonia, varicella, or chickenpox, typhoid, MMR, etc., which have a lot of complications when those infections affect the elders, especially those who are more than 65 years old. So, vaccinating against the new risks and age dependent protection is essential. So, I would recommend taking adult vaccinations for all of us. Then the third important thing is it prevents serious complications. So, what are the complications? Now, vaccines, as we understand prevents the disease. But actually, all vaccinations, they don't prevent the primary infection. They only prevent the complications coming out of the infection. For example, chickenpox. Once we take chickenpox vaccination or typhoid vaccination, it does not confer protection against the infection per se, but it prevents the complications coming out of it. Like in chickenpox, there are life-threatening neurological complications, and in typhoid, there are life-threatening liver and intestinal complications for which we will be protected. The fourth important thing is it strengthens our immune system. How does it strengthen our immune system? By the way of natural aging, the immune system also ages along with us. This is in medical terms called as immunosenescence. And vaccines are nothing but they are re-educating tools for our immune system. It is like you are giving knowledge to our immune system to work again. So they learn new information about the existing viruses and bacteria, and they protect us from these particular infections. The fifth important point is to build up herd immunity or community immunity. So, what is herd immunity? Now, let us take an example wherein you are living in a community which has 500 adults. So, you try to give a mass vaccination drive in your community. You give a particular vaccination for all the 500 adults in one day. What happens then when for a particular disease 500 adults receive vaccination on one day? Chance of spreading that infection becomes very less, because people having that virus or bacteria becomes very less. So during this particular course of mass vaccination, chain of transmission from person to person, it is eliminated. So it confers indirect protection to those people who remain unvaccinated, which are few numbers. So protection of the community by way of mass vaccination drive is very, very important to prevent the chain of transmission and prevents those who for those who are susceptible also. Now, the sixth important point is to manage the long term chronic health conditions. Like, for example, nowadays, adult populations are having a lot of diabetes, hypertension, chronic lung diseases, etc. When these people become infected with any of the vaccine preventable diseases, it gives a lifelong complications, mortality, morbidity, etc. For which giving a vaccination for those patients who are having chronic health conditions becomes absolutely necessary for us. And most important thing is the financial burden. Any patient getting this particular infection will have a long term complication and requires a lot of rehabilitation after the infection is treated also. In that scenario, to decrease the financial burden, giving a vaccine is very much effective. Finally, healthcare costs. Now, I don't need to explain this point of healthcare costs, because healthcare cost is infinite times the cost of the vaccination. And long term treatment, rehabilitation programs are not covered under insurance. So, always prevention is better than cure, my dear friends. So taking a vaccination is more important. Now, let's talk a few lines about pregnant women. You know that pregnant women also receive certain types of vaccinations, especially DPT and flu. The DPT and flu vaccinations, for example, are given during pregnancy. Why are they given? They are given to confer immunity to the unborn child by way of transmitting important and life saving antibodies through placenta to the unborn child. And it also protects those individuals because, as you know, pregnancy is a hypoimmune state. They're easily prone for all these infections, and definitely giving vaccination has a lot of protection. And finally, you have peace of mind. So getting a vaccination and you have a self control that you're you are not affected by these particular diseases gives a sense of satisfaction. And once you have peace of mind, productivity in the work increases. Also, it helps to increase the nation's economic growth. So what are the important vaccinations as adults that we should take? Pneumonia or pneumococcal vaccination taken as a single dose of the pneumococcal conjugate 20 valent vaccination. Influenza vaccination has to be taken annually, and it is important for those who are having allergic bronchitis or allergic respiratory disorders like asthma. Tdap vaccination has to be taken one dose every 10 years, that is the modified DPT. Shingles vaccination, which is nothing but the herpes zoster virus, which is derived out of the chickenpox virus, when affected, causes painful lesions on the skin, especially for those above 50 years of age. So, shingles vaccination has to be taken as 2 doses, followed by MMR and chickenpox. MMR and chickenpox has to be taken as 2 doses, 8 weeks apart. MMR and chickenpox, once affected in adult population, leaves a lifelong neurological complications. Meningococcal vaccination or brain fever vaccination is essential as a single dose. And lastly, typhoid vaccination, which is a very, very important vaccination that should be taken as a one dose. Many parents or many patients are coming to me and asking me about the HPV vaccination or the cervical cancer vaccinations. This is a new vaccination that is to be taken compulsorily for all boys and girls above the age of 9 years. Between 9 to 14 years, it is taken as 2 doses given 6 months apart. But whereas above 14 years, the vaccine can be taken as 3 doses given as 0, 2, and 6 months apart. So, my dear friends, vaccination is a very important aspect. To know details about the adult vaccination schedule, please look into the description box below where I have mentioned all the possible vaccines that need to be taken. And any further thing, please feel free to contact.